Well, good morning and welcome to the Hawai'i Health Data Warehouse's Coffee Break monthly webinar series. I am Julia Chosey with the Hawai'i Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. And we're going to use the next 30 minutes to review the Health Topics module in hhdw.org. In the previous coffee breaks, we've reviewed different ways of searching data on hhdw.org and hawaiihealthmatters.org. We've discussed going straight to the data source to build your own report, and the data sources available on hhdw.org are birth records, death records, the behavioral risk factor surveillance system, the pregnancy risk assessment monitoring system, the youth risk behavior survey, and the youth tobacco survey. We've also discussed using the community reports feature, which is a good resource when you want to look at multiple measures of health in a given community, like a county or race, ethnicity, or sexual or gender minority, and see how they compare to the state as a whole. But today we're going to talk about the health topics feature, which is the health topics module is a good place to start when you know your subject matter, but aren't really sure which surveillance systems have information relevant to your topic. We launched the Health Topics module in 2019 with just 10 topic areas and have since added 10 more for a total of 20. So here you can see all 20 topics available from alcohol to tobacco. Each health topic is composed of two parts. On the left side is the text that gives you important information relevant to the topic area, and on the right side is where you'll find the data. In the text on the left side, each topic includes a definition of the topic with key terms, followed by sections which answer the following questions: why it's important, what is known, who is at risk, and how to reduce risk. Let's take a closer look at the data options on the right side. Indicator reports come in two flavors: HHDW Health Indicator Reports and Hawai'i Health Matters dashboards. For the data on the right side, each topic includes three components for exploring the data: indicator reports, which include HHDW Health Indicator Reports and Hawai'i Health Matters dashboards, customizable reports, and how it's tracked. Now let's take a closer look at the data options. So the indicator reports, as I said, come in two flavors: the HHDW Indicator Reports and Hawai'i Health Matters dashboard. The HHDW Health Indicator Report will show you the data by race, ethnicity, county, and sexual or gender minority. If you've used the community reports feature in HHDW, this will look very familiar to you. The Hawai'i Health Matters dashboards provide a customized collection of related health indicators displayed on our sister site, Hawai'i Health Matters. Here you can see the dashboard for the health insurance displaying all the indicators involved in this topic area. And if you've used Hawai'i Health Matters before, this will look familiar to you. These dashboards are a great way to get a feel for what data is available around a given topic. The customizable reports are indicators in HHDW that are relevant to the selected health topic. Here we see indicators available for death records, BIRFIS, PRAMS, and URBIS. And if you click on the arrow to the right of the data source, the window expands to show you the specific indicators available for each data source, or for that data source. Sometimes a single data source will be divided into relevant categories of indicators. Here we can see the options available for the mental health topic area. As you can see, indicators have been categorized by topic area, such as adverse childhood experiences and cognitive decline. If you click on the arrow to the right of the category, the window expands to show you the specific indicators in that category. After seeing your options for customizable reports, you probably want to get a little deeper into one of the data for the indicator of interest. So if you click on the indicator of your indicator of interest, it will take you to a default report with the 3 most recent years of data, and the data is displayed in both chart and table form. And here, if you've used our Build a Report feature before on HHDW, you'll recognize this as the default indicator report that can then be customized to display the data in any way you want to see it. The last option in the data section shows how the topic is tracked. This highlights data sources with information relevant to the topic area. The hyperlinks will take you to further information about each topic data source. And this is also where you can quickly access the Healthy People 2030 objectives related to the topic area. Let's switch to demo mode, and I invite you to open a browser and follow along. As usual, I'm going to start at our homepage, hhdw.org. And you can navigate to the Health Topics landing page here on the upper left-hand side. Here you can see our 20 available health topics. Since October is Breast Cancer Awareness Month, let's take a look at the cancer topic area. So here you can see a brief description of the topic area and the text that we talked about on the left-hand side. This content gives you information about why cancer is important, what is known, who is at risk, and how to reduce risk. Below this content is a drop-down menu with information about the references cited in the text, so in case you want any further details. And below that, you can find relevant publications and resources. For cancer, this includes publications such as the Hawaii Cancer Plan 2030 and resources such as the Comprehensive Cancer Control Program at the Department of Health. We have populated these state and local resources, but if you have a topic-specific resource that you would like to include, please let us know. Scrolling back up, let's take a look at the right page of the health topic where we can see the data. Beginning with the HHDW Health Indicator Reports, we can see that there are 3 indicator reports available for this topic area. Let's take a look at the Breast Cancer Screening Report. What these reports give you are the data, the 3 most recent years of data by race, ethnicity, by county, and by sexual and gender minority. Below the data is additional information about why the indicator is important and its specific definition. There's also a recommended citation and information on how the calculation is measured. Across the website, you can hover over the graph to get the specific data values, or in this case, you can also change the data view in order to see the data tables. So right here, our data views option, the summary report just gives us the charts and map, but if we were interested in, say, race ethnicity, we could look at the race ethnicity report. And now what we're seeing is the data by race ethnicity in chart and table form. So this gives you all of the data that is shown in the chart. And this can be exported to Excel for your own manipulation. Wherever you see these 3 dots here, it means that you can actually do something with the data. So one option here would be to sort it so that you can get a better idea of which race ethnicities are getting more breast cancer screening versus others. For more information on the health indicator reports and community reports, we have a video in the training resources section under tools and resources. So right up here under tools and resources and training resources, we have several short videos and some longer ones that address different aspects of the website. So that's always a great place to check. All right, let's go back to our cancer health topics page. Below the HHDW health indicator reports are the Hawaii Health Matters custom dashboards. Let's look at the skin cancer dashboard. So this will open up a window on our sister site, Hawaii Health Matters. And what this shows is a curated dashboard. It's a custom collection of all of the indicators that have anything to do with skin cancer that are available in HHM. So you can see here we've got prevalence, we've got incidence, we've got death rates, and then we also have some sunscreen information. The default report is for the state of Hawaii, but you can change the geography here if you were interested in looking at a particular county or another geographic location. You can also add and subtract indicators here. You can add them just by using search keyword terms and it'll pull up options, or subtract them by hitting the little X. So you can customize this dashboard even more to whatever you are interested in looking at. And when you do this, then you can save a link to this search and you can use that to come back to it later or to share it with other people. We do have a colorblind mode for people with visual disabilities. So what this does is it just adds the little thumbs up and thumbs down icons next to each of the data values to give you an idea of which ones are improving and which ones aren't. And you can also look at the data by card view, which is demonstrated here. It's just another way of looking at the data. I'm going to switch back to list view because that's kind of what I'm used to. So you get a nice overview of the data for all of these indicators right here, your point estimate value, and then some comparison values. But if you want to learn a little bit more, you can click on a specific indicator and it will take you to a page showing more information about that specific indicator, including the definition. So here's the percent of adults who have ever been told by a healthcare professional that they had skin cancer, a little bit about why it's important, And then we get into the data. So as we can see, 4.8% of adults in 2021 reported having had skin cancer. And this comes from the Behavioral Risk Factors Surveillance System. The values here are to put that 4.8% into a little more context. So you can see that that value is lower than the median value for states and territories, which is 6.6%. It's about equal to the prior value of 4.5%. It's trending up, but not significantly. And we have not yet met the cancer plan target of 4.1%. As you can see, you can hover over these icons and it gives you a little information about each one. There's also a legend here that's always available on the left side of the page, and this will help remind you what the different icons mean and how to interpret it with the different colors. Below these comparison values, we see the trend data. And again, here you can hover over the graph and get the actual data values. You can also download this as a PDF or a JPEG, and you can download the underlying data as a CSV to do your own manipulations. There's also chart options, such as showing confidence intervals. Below the trend data is where you'll start to see our subgroup data, our breakout data. So this is where you can get a little bit more information about this indicator, adults who've had skin cancer. So looking at the first one by age, we can see that younger people are statistically better than the state overall. They're statistically less likely to have skin cancer, and older people are statistically more likely, which of course makes sense with the amount of time that you're able to spend in the sun. But there's also, the data is also shown by education level, by employment status, by percent of federal poverty level, by race, ethnicity, by sex, and sexual orientation. Below this data is again a geography selection. So here, this indicator is available by state and county. So if you were interested in seeing the county level data, this will give you a graph and chart and a table with the different information. And again, you have access to these comparison values up here. I wanted to point out the cancer plan target because not every indicator has a target value. What that means is that this indicator is part of a tracker, and it is being tracked to meet target values for, in this case, the year 2030. We do have several trackers around different topic areas. If you're interested in seeing them, you can just go here to the track progress and you can see all of our different trackers. Below that is where you get the related content that Hawaii Health Matters offers. So this is where you'll see related indicators, reports, data resources, fact sheets, plans, and infographic. And there's also a topic center on Hawaii Health Matters that's similar to our health topics on HHDW, but it's a little more broad. So if you click on something like economy, it will pull up all of the relevant resources that it has in this economy topic center. So another way to look and see what kinds of information is available. I'm going to go back to Hawaii Health Data Warehouse, which we can do from the Hawaii Health Matters page right here. And we'll go back to our health topics and back again to our cancer topic. So we talked about the indicator reports and the Hawaii Health Matters dashboards. The next thing that's available are the customizable reports. So you can see here we have data from death records, from BRFIS for cancer prevention, screening, and survivorship, and from YRBS. So let's say I'm interested in youth data and I want to see what kind of information there is available around cancer for youth. In this case, it's sunscreen usage. So most or all of the time for high school or middle school students. And let's take a closer look at what this shows us. So here you get this default report, and the query criteria box right here will show you exactly what you're looking at. So we're looking at the years 2017, 19, and 21 for the state, and it displays the data by year. There's a chart where you can also hover over to get the data values, or there's also a data table here. And again, you can export that to Excel for your own manipulation. Below that are our technical notes, which is a good thing to keep an eye on as far as it gives you the actual question wording and information about suppression and weighting and a citation and any other data issues that you might need to be aware of when you're interpreting this indicator. So for those of you who have used the Build Your Own report, you recognize this as our default query report. However, it's just the default and you can modify it. So if we go to Modify Query here, we come to this Query Builder page. And what this shows you, these first 7 steps are basically filters. So if you were interested in just a particular grade, you could select, say, seniors. If you were interested in just males or females, you could limit the search to that. If you had a particular race ethnicity that you were interested in, you could select that and it would limit the data to just that population. We also have information about ethnicity, sexual orientation, transgender, and sexual or gender minority. But this last step here, step 8, is where you really show the system how you want to see the data. So what we're seeing right now, we saw the data by year in a horizontal bar chart. But let's say that we're interested in seeing it by race, ethnicity, and in a vertical bar chart with data labels. So now what we see is the data by race, ethnicity, with the data labels in the vertical chart showing us sunscreen usage among high school students. And again, the data table is here for your analysis. But the wonderful thing about IBIS, this indicator-based information system, is that you can actually look at the query by 2 different dimensions at the same time. So right now we're looking at it by race, ethnicity, but say we also wanted to look at it by sex. Now what we're going to see is a chart, a graph showing the data broken out by both race, ethnicity, and by sex. And if you were interested in just visualizing, say, just the females, you can click on this down here and it'll show you just the females, or just the males if you want to do it that way. So this is a nice little functionality of the program that helps you really be able to see the data. And again, you've got your data table with all of your information that can be exported to Excel. Let's take a look at the very last piece of the data component in our cancer topic area, which is how it's tracked. So this shows you parent data information from Hawai'i Health Data Warehouse and other national data sources. It is also where you can link to Healthy People 2030 cancer objective page for this example. All right. Let's move into a little activity. I have 3 questions for you, which can all be answered using the Health Topics module on HHDW. What are the most common forms of cardiovascular disease? In 2021, what percentage of adults in Hawaii reported having had a stroke? And what are some sources for data on disability? So I'll give you a minute, play around with the website and see if you can find the answers to these questions. While you're looking, I want to make sure to invite you to join us next month on Tuesday, November 7th at 11 a.m., where we will be discussing the leading causes of death reports. It's a new feature that we're launching, so it'll be very interesting and informative. All right, let me show you where we can find these answers if you haven't found them already. So what are the most common forms of cardiovascular disease? So heart disease, heart attack, and stroke. And I found this in the cardiovascular disease health topic area. So again, if we go to health topics and cardiovascular disease, we can see the very first thing in the definition is the 3 most common forms of cardiovascular disease. So that's where I found that. In 2021, what percentage of adults in Hawaii reported having had a stroke? The answer is 3% in 2021. And there's actually 2 places that you could have gotten this information from in the health topics. There's the Hawaii Health Matters dashboard on stroke, which would give you the stroke prevalence there. And then there's also directly going to BRFIS and getting the stroke prevalence data there. So those are 2 ways of answering that question. And then the last question is, what are some sources for data on disability? And again, we can get that from this information about how it's tracked. So here we see some resources that show different ways for tracking data on disability. So I hope this brief overview has helped you become more familiar with the Health Topics feature in HHDW. Thank you very much for your time. And I hope you take the next half hour to work on your own and explore the Health Topics feature in hhdw.org. If you have any questions, please contact us at profiles@hhdw.org. So we look forward to seeing you next month on Tuesday, November 7th, when we will be discussing our new leading causes of death reports. Mahalo and enjoy the rest of your day.